Good day, cadets and cadets. I am your instructor for the day. But before we proceed to our lesson, let me first introduce
I am
myself.
Sergeant John Vincent S. Villanueva, Philippine Army Reserve, from 105th Community Defense Center, 1st Regional Community Defense Group. I live at Cambanan, Ordaneta City, Pangasinan. I am 22 years old. I was born on May 2, 1998. I graduated my advanced ROTC at Pangasinan State University, Ordaneta ROTC Unit. I am a fourth-year student of University of Eastern Pangasinan. I finished my ROTC Summer Camp Training, Advanced ROTC Academic Phase Training, 3132, 4142, Active Duty Training at Camp Lieutenant Tito B. Abat, Manawag, Pangasinan. Before we start our lesson, let's use our classroom rules. If you have your cell phone with you, kindly turn it in silent mode. And if you feel sleepy, just go at the back and do some exercise. And if you need a comfort room, just go to the CR. For the safety precaution, in case of fire, immediately go to the fire exit. If you feel sudden earthquake, perform drop, cover, and hold. And after the shaking, go immediately to an open area. Our subject for today, cadets and cadets, is all about basic first aid. The objective of this subject is to acquaint the student on the different medical terms that are strange to them, to understand the importance of the subject, the basic life-saving steps, and to be able to apply first aid to the different cases encountered. And now, let's go to the definition of terms. First one is first aid. Temporary care given to an injured or ill person before a definitive can be given by a medically trained person. Second one is self-aid, a care given to oneself. Third is first aider, a person who gives first aid. Fourth one, wound, a break in the continuity of the skin, mucous membrane, and tissue. Shock, a state or condition wherein there is not enough or adequate blood supplies to the vital tissues and organs. Dressing is a sterile pad, a compressed sponge, or any other materials that is clean and directly applied to the cover the wound. Hemorrhage, escape of large quantities of blood from the blood vessels. Splint, any flat-like materials, ready-made or improvised, used to hold fracture. Fracture, a break in the continuity of the bone. Artificial respiration is a procedure for causing the air to flow into and out of the lungs of a person when its normal or natural breathing is inadequate or has ceased. For the next slide, we will know the importance of first aid. First one is to save life, para makapagligtas ng buhay. The second is prevent permanent disability, upang maiwasan naman ang permanenteng kapansanan ng pasyente. The last is reduce prolonged hospitalization, para maiwasan ang matagal na pananatili ng pasyente sa ospital. General procedures in case of injury. Give the patient comfort. Siguraduhing kalmado ang pasyente. Assure the patient that his condition can be taken care of. Tiyakin natin ang pasyente na maalagaan ang kanyang kondisyon. Handle the patient gently. Asikasuhin ng marahan ang pasyente dahil baka ito ay may bali. Never give anything in mouth to unconscious person. Huwag kailanman magbigay ng anumang bagay sa bibig ng taong walang malay, dahil ito ay maaaring bumara sa daanan ng kanyang. We have three basic life-saving steps. First, check for breathing. The second, check for bleeding. And the third one is check for shock. This is the procedure on how to check for breathing. First, place your ear over the casualty's mouth or nose and look towards his chest. Second, look for the rise and fall of the casualty's chest. Third, listen for the sound of breathing. Fourth, feel for breath on the side of your face. The last one, allow 3 to 5 seconds to determine if the casualty is breathing. If negative, perform rescue breathing through artificial respiration. But first, what is artificial respiration? Rescue breathing through artificial respiration. The restoration or substitution of someone's breathing by manual, mechanical, or mouth-to-mouth method. I will discuss to you four kinds of artificial respiration: the mouth-to-mouth method, mouth-to-nose method, mouth-to-stomach method, and chest pressure arm lift, or what they call Sylvester's method. First, mouth-to-mouth method. Procedures. Place the victims on his back. If foreign bodies are visible in the victim's mouth, wipe it out quickly with your fingers. Tilt the victim's head backward so that his chin is pointing upward. Maintain the head tilt backward position. To prevent leakage of air, pinch the victim's nose straight or press your cheek against the victim's nose. Open your mouth widely. Take a deep breath and seal your mouth tightly around the victim's mouth, and with your mouth forming a wide open circle, blow into the victim's mouth. Volume is important. You should start at a high rate and then provide at least one breath every 5 seconds. Adult, or 12 per minute. Watch the victim's chest. When you see it rise, stop blowing. Raise your mouth and turn your head to the side and listen for exhalation. Watch the victim's chest to see that it falls. When the victim's exhalation finish, repeat the blowing cycle. Mouth to nose method. Procedures. Maintain the backward head tilt position with the hand on the forehead. Use the other hand to close the mouth. Open your mouth widely. Take a deep breath. Seal your mouth tightly around the victim's nose. On exhalation phase, open the victim's mouth to allow air to escape. When administering mouth-to-mouth or mouth-to-nose ventilation to small child or infants, the first aider should not take the backward head tilt as extensive as that of the adult or large children. Both mouth and nose of an infant or small child be sealed by your mouth. Blow into the mouth and nose severe 3 seconds or 20 per minute with less pressure and volume than for other adult or large children. The amount is determined by the size of the child. Small puff of air will suffice the infants. If you are not getting air exchange, recheck the position of the victim's head and jaw, and investigate to see whether there is foreign body in the back of the mouth obstructing the air passage. If the victim's stomach is bulging, air may have been blown into the stomach. Turn the victim's head to one side and be prepared to clear the mouth before pressing your hand briefly and firmly over the upper abdomen, the ribs and the navel. Mouth to stoma method. But first, what is stoma? Stoma is an opening in the windpipe in the front of the neck of a person whose larynx have been completely or partially removed by a surgery. And here's the procedure on how to do the mouth-to-stomach method. Do not breathe into the victim's nose or mouth. Use mouth-to-stomach respiration. Use the same general procedure as for the mouth-to-mouth resuscitation, but place your mouth firmly over the victim's stomach and blow the same rate as for a person who breathes normally.
Kapag kayo ay bystander sa isang aksidente, lalo na at mahal nyo sa buhay ang biktima, agad na alamin kung humihinga ito sa pamamagitan ng pagtingin kung tumataas at bumababa ang dibdib nito. Kapag hindi humihinga, dapat nakahanda tayo na mag-hands-only CPR. Kritikal ang ating reaksyon dahil sa loob lamang ng ilang minuto, maaring ikasawi ng biktima kung hindi tayo makapagbibigay ng CPR. Kung hindi naman tayo nag-iisa sa scene, utusan ng isa sa inyong mga kasama o isa sa mga bystander na tumawag agad ng tulong sa mga emergency medical services, kagaya ng 911 UNTV. Lumuhod sa gilid ng pasyente. Ipatong ang inyong kaliwang palad sa kanang palad o vice versa. At ilagay ang heel ng inyong kamay sa dibdib ng pasyente sa bandang itaas ng sikmura. Siguraduhing diretso ang inyong likod at buong balikat at siko habang nagbibigay ng kompresyon. Ngayon, umpisahan na ang pagdiin sa dibdib ng pasyente. Kailangan ay lumubog ng 2 to 2.4 inches ang dibdib ng pasyente para siguradong may dadaloy na dugo papunta sa utak. Magbigay ng 100 to 120 na compression sa loob ng 1 minuto. Kung hindi formal ang inyong training sa CPR, kagaya halimbawa ay natutunan nyo lamang sa programang ito, maaaring huwag nang magbigay ng hininga sa bibig ng biktima at ituloy na lamang ang pagbibigay ng chest compression. Kung may makakapalitan sa pagbibigay ng chest compressions, mas maigi ito para pareho pa rin ang quality ng pagre-revive sa pasyente. Tandaan na dapat ay not too hard, not too fast ang pagbibigay ng compression. Ituloy lamang ang CPR hanggang dumating ang rescue team o kaya naman ay magpakita na ng sign of consciousness kagaya ng pag-ubo, pagdilat ng mata at pagsasalita at maging normal na ang paghinga. As I mentioned earlier, mahalaga na pareho ang level ng quality ng revival sa pasyente. Kapag napagod, dapat may makakapalitan sa pag-revive sa pasyente. Sa pagbibigay ng hands-only CPR, ito ang mga dapat tandaan. Ipatong ang inyong palad at ilagay ang heel ng inyong kamay sa dibdib ng pasyente sa bandang itaas ng sikmura. Magbigay ng 100 to 120 na pagdiin sa dibdib. Not too hard, not too fast. Ituloy ito hanggang ma-revive ang pasyente o dumating ang rescue team.
And now for the fourth artificial respiration, the chest arm lift or Sylvester's method. Procedures. If foreign bodies are visible in the victim's mouth, wipe it out quickly with your fingers, preferably with cloth wrapped around them. Place the victims in a face-up position. Maintain an open airway by placing something under the victim's shoulder to raise them several inches and allowing his head to drop backward. Turn the victim's head to the side. Kneel at the top of the victim's head. Grasp the wrists and across them over the lowest chest. Rock forward until your arms are approximately vertical and allow the weight of the part of your body to exert steadily, even pressure downward. This action will cause air to flow out the victim's chest. Immediately release the pressure by rocking back, pulling the victim's arms outward and upward over the victim's head and backward as far as possible. These procedures will cause the air to flow in. Repeat the cycle about 12 times per minute, checking the victim's mouth often for obstructions.
Alternative method of artificial respiration, Sylvester method. In some instances, mouth-to-mouth respiration and mouth-to-nose respiration cannot be used. For instance, certain toxic and caustic materials constitute a hazard for the rescuer, or facial injuries may prohibit the use of the mouth-to-mouth or mouth-to-nose technique. It is particularly recommended for patients who have swallowed poison. Procedure: remove the shoes, helmet, gloves, and foreign materials from the pockets. Lay the patient on his back on a firm surface. Raise his shoulders on a cushion or folded jacket, or in some other way. With head fully back. Shoulders should be raised on rolled clothing. Kneel astride the patient's head. If necessary, turn his head to one side to clear out the mouth. Grasp his wrists and cross them over the lower part of his chest. Rock your body forward and press down on the patient's chest. Release the pressure and, with a sweeping movement, draw the patient's arms backwards and outwards as far as possible. Repeat this procedure rhythmically, 12 times per minute. Keep the mouth clear.
Airway obstructions. Airway obstructions can be partial or complete blockage of the breathing passages to the lungs. Causes may include the presence of foreign matter, allergic reaction, infection, anatomical abnormalities, and trauma. There are two types of airway obstruction. First is partial airway obstructions. The patient will be able to breathe and cough, although there may be crowing noise as air passes through a narrow space. The second is complete airway obstruction. Don't allow any air to pass. You cannot breathe if you have a complete airway obstruction. And now let's talk about the maneuvering techniques on removing obstructions. The back blows. This is the step on how to perform back blows on unconscious patient. Roll the casualty onto his side facing you with his chest against your thigh. Deliver 4 sharp blows in rapid succession to the casualty's back between the shoulder blades. For conscious patient, position yourself to the side and slightly behind the casualty. Place your left hand on his chest to support him. Give 4 sharp blows in rapid succession with the hand on the other arms to the casualty's back between the shoulder blades. The abdominal thrust. For conscious patient, stand behind the casualty and wrap your arm around his waist. Make first with one hand and grasp it with the other hand just below the navel or in the abdomen. Give 4 succession inward and upward motion. For unconscious patient, position the casualty on his back. Perform the thrust either astride or along the side of the casualty. If you are along the side of the patient, your knees should be close to his thigh or hips. Straddle the hips on one thigh of the casualty. Place the heel of one hand against the casualty's abdomen between the waist and the rib cage. Put second's hand on top of the first one. Position and maintain your shoulder over the casualty's abdomen. Apply a quick inward and upward abdominal thrust toward the casualty's head. The chest thrust. For conscious patient, stand behind the casualty and wrap your arm around his chest with your arms under his armpit. Make fist with one hand place the thumb of the fist squarely on the breastbone. Grasp the fist with the other hand. The exert for quick backward and upward pull. Alternate 1 and 3 until casualty recover. For unconscious patient, position the casualty on his back. Kneel close to the side of the casualty's head and locate the lower edge of the rib cage with your finger. Trace the rib cage. With your arms in position, bring your shoulder directly over the casualty's breastbone. Keep your arms straight and press downward. Apply enough pressure to push the breastbone downward, about 1 to 2 inches, and then release the
Kung may
pressure
foreign
completely.
object na ma-stuck sa lalamunan ng isang tao, maaari itong magdulot ng panganib dahil mapipigilan nito ang paghinga. Ito ang tinatawag na choking. Ang mga palatandaan na ang tao ay nacho-choke, maaaring hindi siya makapagsalita, hindi rin makaubo, at hindi makahinga ng normal, at maaaring mawalan ng malay. At kung hindi ito maagapan, ay maaaring mauwi sa kamatayan. Kapag kayo ay bystander sa ganitong pangyayari, dapat mabilis ang ating reaksyon para matulungan ang isang taong nacho-choke. Kung conscious ang pasyente, tanungin siya kung nacho-choke o nabibilaukan.
Sir, nabibilaw ka ba kay sir? Sir.
Kapag nakapagsasalita ang pasyente, ay hikayatin siya na umubo ng malakas upang mailabas ang obstruction.
Sir, upo ka sir. Isa pa sir.
Kung hindi naman siya makapagsalita at tumangulang, ay umpisahan ang abdominal thrust. Pumunta sa likuran ng pasyente at gawin ang tripod position. Ilagay ang nakasaradong kamay sa sukat na 2 daliri sa ibabaw ng pusod. Gawin ang inverted J motion hanggang sa mailabas ang nakabara o mawalan ng malay ang pasyente. Kapag nawalan ng malay ang pasyente, ay agad siyang ihiga sa matigas at patag na lugar gaya ng sahig. I-check o tignan ng bibig kung may lumabas na foreign object at alisin ito sa pamamagitan ng finger sweep. Kung naalis na o wala namang lumabas na foreign object, sunod na magbigay ng 30 chest compressions. Ituloy lang ang pagkasunod-sunod hanggang sa magkamalay ang pasyente o dumating ang tinawagang rescue team. Kung magkamalay naman ang pasyente, gawin ang recovery position. Tandaan, kung ikaw ay bystander at may biktima ng choking, narito ang mga lifesaver steps na pwede ninyong gawin. Kung may malay ang pasyente, tanungin kung siya ay nacho-choke o nabibilaukan. Hikayatin ang pasyente na umubo ng malakas kung siya ay nakapagsasalita. Isagawa ang abdominal thrust sa pasyente kung hindi siya nakapagsasalita. Kung nawalan ng malay, gawin ang sequence na i-check ang bibig kung may lumabas na foreign object. Magbigay ng 30 compressions hanggang magkamalay o dumating ang rescue team. Kung magkamalay naman ang pasyente, gawin...
The second and basic life-saving step is checking for the bleeding. What causes bleeding? Of course, if there's a wound, there's a bleeding. But first, what's a wound? Wound, an injury to living tissue caused by a cut, blow, or other, typically one in which the skin is cut or broken. To the next slide, we will know the different wound. First one is puncture wound, usually caused by a sharp pointed object such as nails. Incise wound, caused by a sharp bladed object with a clean cut. Lacerated wound, caused by any hard or blunt object. Abrasion, a wound resulting from scraping rough surfaces. Avulsion, a kind of wound that involves a forcible separation or tearing the tissue from the victim's body. And now for the treatment of wound. Expose the entire area of the wound to easily trace the type and size of the wound. Avoid contamination. Cover the wound with sterile dressing. Elevate off the bleeding part. Treat for shock. And for the first aid measures, elevation, raising the injured part above the heart level. Direct pressure, pressing a sterile dressing firmly over the bleeding part. Digital pressure, finger pressure applied directly over the bleeding part. Tourniquet, a constricting band placed around the arm or leg to control bleeding. And now let's talk where to use tourniquet. Place the tourniquet around the limb between the wound and the heart. It should be placed 2 to 4 inches above the injury site. Mark the casualty's head with a T, preferably his blood whenever possible. Do not cover the tourniquet, leave it in full view. Record the time of application. And then let's on to dressing. What is a dressing? Dressing is a sterile pad, a compressed sponge that is applied directly to cover the wound. What are the uses of dressing? First, to control bleeding, upang makontrol ang pagdurugo ng pasyente. The next one, to cover wound and keep out dirt and bacteria which may cause infection. Upang takpan ang sugat at maiwasan ang dumi at bakterya na maaring maging sanhi ng impeksyon sa sugat ng pasyente. To absorb excess fluid, upang makuha ang labis na likido. For example na lang, may mga foreign liquids na nabuhos sa sugat ng pasyente. To maintain temperature around the wound, upang mapanatili ang temperatura sa paligid ng sugat. To apply medication, upang malapatan ng gamot. Rules for applying dressing. Apply dressing directly over the wound. Direktang ilapat ang dressing sa sugat. Avoid contamination. Iwasan natin ang kontaminasyon sa sugat ng pasyente dahil ito'y magdudulot ng impeksyon. Use the tail of a dressing as bandage whenever possible. If the dressing is secured by tying, place the knot where they are easy to see and react. Never tie knot over the wound. Kung ang dressing ay na-secure sa pamamagitan ng pagtatali, ilagay ang buhol kung saan madali itong makita at tanggalin. Huwag kailanman itali ang buhol sa ibabaw ng sugat. Following dressing is applied, it should not be disturbed or replaced unless hemorrhage recurs or dressing exposed the wound. The third one on basic life-saving step is checking for shock. What is a shock? A state of condition where there is not enough or adequate blood supplies to the vital tissues and organs. What are the causes of shock? Significant loss of blood. Maraming dugo ang nawala sa katawan ng pasyente. Heart failure. Pagpalya ng puso, halimbawa na lang, is heart attack. Dehydration. Kulang ng tubig ang katawan ng ating pasyente. Severe and painful blows to the body. matindi at masakit na suntok, sipa, o pagpalo sa katawan. Severe allergic reaction to drugs, foods, insect sting, and snake bites. Matinding reaksyon ng katawan sa gamot, pagkain, kagat ng insekto o ahas. And now let's proceed to signs and symptoms. Sweaty but cool skin. Pawisan pero malamig ang balat. Paleness of the skin. Pamumutla ng balat. Restlessness or nervousness. Hindi mapakali at kinakabahan. Thirstiness o pagkauhaw. Faster than normal breath. Mabilis na paghinga kaysa sa normal. Pupils are dilated. Paglaki ng pupil ng mga mata. Pulse is rapid. Mabilis na pulso. Nausea or vomiting. Pagduwal o pagsusuka. And for the first aid measures, prevention from heat exposure, loosen the clothing, control bleeding, replacement of fluids, control the pain, prevent the casualty from chilling or overheating, elevate the casualty's feet higher than the level of the heart, NPO to unconscious patient.
Madalas nating naririnig kapag mayroong aksidente na dapat hindi mapunta sa state of shock ang biktima. Ano nga ba ang ibig sabihin ng shock? Kapag na-injured ang katawan, halimbawa sa pamamagitan ng isang aksidente, ang katawan ay nagre-react upang labanan ang damage. Kapag malubha ang kalagayan ng isang biktima, maaaring magka-shock na ibig sabihin ay may problema sa circulatory system ng katawan. Basically, ang shock ay kawalan ng kakayanan ng circulatory system ng katawan na mag-provide ng oxygenated blood sa mga vital organs nito. Hindi nakaaabot ang dugo sa dapat nitong puntahan, kaya kinukulang ng oxygen ang katawan. Ang mga sintomas ng shock ay panghihina, pagkahilo, pagkauhaw, anxiety, pagsusuka, panginginig, altered mental status. Maaaring disoriented na ang pasyente, hinahabol ang hininga, mabilis ang tibok ng puso, namumutla at nanlalamig ang balat. Maaaring nagiging kulay asul ang ilang bahagi ng labi, dila at tenga. Kung wala namang sinususpetsyang spinal cord injury ang biktima, maaari siyang galawin at iposisyon ng ganito. Una, kapag walang kahit anong injury sa bewang, pababa hanggang binti, ihiga siya at i-elevate ang paa. Kung mayroon kayong makukuhang maaaring maikumot sa biktima, gaya ng blanket o kumot, gawin ito para mapanatili ang body temperature at maiwasan ang panlalamig. At kung may makitang pagdurugo, agad itong lapatan ng paunang lunas. Makatutulong ito sa management ng shock. Kausapin at kalmahin ang pasyente. Siguraduhin sa kanya na may parating na rescue team upang siya ay tulungan. Hindi maaaring ma-reverse ang epekto ng shock, ngunit maaaring mapabagal ang pagkakaroon ng biktima ng shock at makatutulong ng husto sa pagliligtas ng kanyang buhay. Tandaan, kapag kayo ay bystander sa isang aksidente, ito ang mga mahalagang maitulong sa isang biktima na maaaring mapunta sa isang state of shock. Tumawag agad ng emergency medical services. Control the bleeding sa pamamagitan ng direct pressure para hindi na mawalan pa ng dugo ang biktima. Panatilihing normal ang body temperature. Tulungang makahinga o makaposisyon ng komportable ang biktima. Mapakalma ang biktima.
And now let's move on to fractures. What is a fracture? A break in the continuity of the bone. There are two classifications of fracture. First one is the open fracture, and the second is closed fracture. Causes of fracture. Motor vehicle accident. Aksidente sa anumang uri ng sasakyang pangtransportasyon. Falls o pagkahulog. Accident related to recreation, sports, and activities. Aksidente na naugnay sa mga sports at aktibidad na libangan. Some result from very slight injuries because of brittle or abnormal bones. Ang ilang resulta mula sa napakaliit na pinsala dahil sa mahina o abnormal na buto. For signs and symptoms, we have deformity, tenderness of the affected area, swelling, pain, presence of protruding bone, inability to move the injured part, bleeding, discoloration of the affected area. And for first aid measures, immobilize fracture by splitting. Control bleeding and apply sterile dressing to an open wound. Treat for shock. Give pain reliever if pain is severe. Avoid unnecessary holding of the injured part. Place the patient on a litter and secure the injured part enough to keep it from moving while he is transported. Evacuate the patient as soon as possible. For the next slide, we will talk about snake bites. Why is it snakes are dangerous? It's because of venom. Venom is a poisonous secreted by some animals injected into the body of the victims through bites. There are two types of snakes. There are poisonous snakes and non-poisonous snakes. Here are the physical characteristics of poisonous and non-poisonous snakes. First, we have flat and almost triangular head shape with poison sac, slit-like pupils with sensory pit, fang mark on the bite side, thick bodies, color markings.
Number 6. Equatorial spitting cobra, also known as black spitting cobra. This species of cobra is found in the equatorial Southeast Asian nations of Brunei, Indonesia, Malaysia, Singapore, Thailand, and in the Philippines. This is highly venomous species which should be treated with caution. Typically, this snake prefers to avoid confrontation and is not considered aggressive. However, large adults will stand erect, expand their hood, and hiss loudly if feeling threatened. If the perceived attack does not back off from his threat display, the snake will then attempt to spray venom in the eyes of its tormentor. Number 5. Waggler's pit viper. It is sometimes referred to as the temple pit viper because of its abundance around the temple of the Azure Cloud in Malaysia. This is a venomous pit viper species native to Southeast Asia, also found in southern Philippines. The Philippine pit viper is nocturnal and arboreal. They appear quite sluggish as they remain motionless for long periods of time. Waggler's pit viper has strong venom that usually does not result in death to humans. Victims experience a strong burning sensation upon envenomation and swelling, necrosis of tissue. Waggler's pit viper is generally found on low vegetation, but a careful search may also locate the species at mid-canopy level many meters above the ground. Number 4. Philippine pit viper is a venomous pit viper species endemic to the Philippines. 3 subspecies are currently recognized, including the nominate subspecies. Found on the Philippine islands of Agutayan, Batan, Camiguin, Catanduanes, Dinagat, Jolo, Leyte, Luzon, Mindanao, Mindoro, Negros, and Polillo. Number 3. The Philippine cobra, also called Northern Philippine cobra, is a stocky, highly venomous species of spitting cobra native to the northern regions of the Philippines. The Philippine cobra is called ulupong in Tagalog. The Philippine cobra's habitat include low-lying plains and forested regions, along with open fields, grasslands, dense jungle, agricultural fields, and human settlements. This species of cobra is particularly fond of water, so it can be found very close to ponds, rivers, or large patterns of waters. Philippine cobra is considered to possess one of the most toxic venom among all of the cobra species. These snakes are capable of accurately spitting their venom at a target up to 3 meters away. The Philippine cobra occurs mostly in the northern regions of the Philippines. They can be found on the islands of Luzon, Mindoro, Catanduanes, and Masbate. Number 2. The Samar cobra, also called Visayan cobra, is a highly venomous species of spitting cobra native to the Visayas and Mindanao Island groups of the Philippines. The Samar cobra's venom is a potential deadly neurotoxin. Envenomations can result in respiratory distress and paralysis, as well as considerable tissue necrosis around the bite site. They are noted for their nervous behavior and are quick to strike as well as to spray venom, which they generally aim towards the face and eyes. If venom gets in the eyes, it causes extreme pain and mechanical damage to the eyeball. If not properly flushed out, it can result in permanent blindness due to its tissue-destroying properties. And for number 1, King Cobra. It is the world's largest venomous snake. It preys chiefly on other snakes, and occasionally on some other vertebrates, such as lizards and rodents. It is a highly venomous and dangerous snake when agitated or provoked that has a fearsome reputation in its range. Although it is typically shy and avoids confrontation with humans when possible. The king cobra's venom consists of toxins affect the victim's central nervous system, resulting in severe pain, blurred vision, vertigo, drowsiness, and eventually paralysis. If the envenomation is serious, it progresses to cardiovascular collapse and the victim falls into a coma. Death soon follows due to respiratory failure. The affected person can die within 30 minutes of envenomation.
That's all for poisonous snakes. And now let's go for the non-poisonous snakes. Oval-shaped head. No sensory pit. No fang mark on the bite site. Rounded pupil. And that's all for physical characteristics of snakes. And for have the casualty lie quietly, not to move other than necessary. Do not elevate the bitten extremity. Keep them level with the body. Keep the casualty comfortable and reassure him. If the snake bite is on arm or leg, place a constricting band about 1 to 2 finger above and below the bite. If the bite is on the hand or foot, place a single band above the flow of blood near the skin but not tight enough to interfere the circulation. If swelling extends beyond the band, move or place another band above the first one. Never give the casualty food, alcohol, stimulants, drugs, or tobacco. Remove rings, watches, or other jewelry from the affected area. Evacuate to the nearest medical facility as soon as possible.
Ngayong panahon ng baha, may ilang mga tiyempo na may nakalalabas na ahas kahit sa mga syudad. Dapat tayong mag-ingat at lalo't higit, dapat alam natin ang mga gagawin kung tayo o isa sa ating mga mahal sa buhay ay maging biktima nito. Maaaring nakagat ang isang biktima, ngunit hindi niya ito namalayan. Narito ang ilang palatandaan upang malaman kung nakagat ng ahas. A pair of puncture marks, dalawang magkatabing sugat na tila kagat ng hayop, matinding sakit, pamumula at pamamaga sa kagat, pagkahilo at pagsusuka, hindi malinaw ang paningin, paglalaway at matinding pagpapawis, hirap huminga. Tumawag agad ng emergency medical services kagaya ng 911 UNTV. Ibigay ang mga impormasyong kailangan ng mga emergency dispatcher. Mahalagang ma-identify ang oras kung kailan kinagat at kung natatandaan ang itsura ng ahas para malaman ng mga medical personnel kung anong anti-venom ang ibibigay. Kung nakahandang tumulong ng direkta sa pasyente, ito ang inyong mga maaaring gawin. Kalmahin ang pasyente. Kontrolin kung may pagdurugo. Siguraduhing maiposisyon ang pasyente nang mas mataas ang puso sa parte ng may kagat ng ahas. Huwag masyadong pagalawin at kausapin ang pasyente upang siya ay maging komportable. Bigyan siya ng kasiguraduhan na may darating na tulong mula sa mga emergency medical services. Tandaan, kapag kayo ay bystander sa isang snake bite, narito ang inyong mahalagang maitulong sa biktima. Makatawag agad ng emergency medical services. Maipwesto siya na elevated ang puso kaysa sa kagat ng ahas. Malagyan ng pressure bandage ang sugat at paligid nito. Mapakalma ang pasyente hanggang dumating ang rescue team.
Do not attempt to cut or open the bite nor suck out the venom. If the venom creep through any damage of your lacerated tissue in your mouth, you should immediately lose consciousness or even die. Huwag na nating subukang hiwain o buksan ang sugat o sipsipin ang lason. Kung ang kamandag ay mapunta sa anumang nasira o sugat sa loob ng ating bibig, maaari ka mawalan ng malay o daliang mamatay. And that's all for snake bite. Climatic injuries. The hazards in the environment with possible priorities on toxic chemicals, microbiological agents, radiation, climate change, and injuries. Sa ating mga Pinoy, ang common nating nararanasan ay heat injuries. Ano nga ba ang heat injuries? Heat injuries are environmental injuries that may result when an individual is exposed to extreme heat such as from the sun or from high temperature. Meron tayong tatlong categories sa heat injuries. Andiyan ang heat cramps, heat exhaustion, heat stroke. Let's go to heat cramps. What is heat cramps? Are caused by an imbalance of chemicals called electrolytes in the body as a result of excessive sweating. For signs and symptoms, muscle cramps in the arms or legs and stomach, wet skin, extreme thirst. Treatment for heat cramps. Move the casualty to a shady area or improvise shade. Loosen clothing. Have him or her drink slowly at least 1 canteen full of water. Seek medical aid when cramps continue. For heat exhaustion, caused by loss of water through sweating without adequate fluid replacement. For signs and symptoms, weakness and faintness, dizziness or drowsiness, cool or moist skin, pain, headache, rapid breathing, tingling of hands and feet. Treatment for heat exhaustion. Move the casualty to a shady area and have him lie down. Loosen clothing and remove boots. Pour water on him and fan him if it is very hot day. Have him slowly drink 1 canteen full of water. If possible, the casualty should not participate in any vigorous activity for the remainder of the day. Monitor the casualty until the symptoms are gone. If the symptoms are persist, seek medical aid. For the third one, we have heat stroke. This is a medical emergency and can be fatal if not treated promptly and correctly. It is caused by failure of the body's cooling mechanism Inadequate sweating is a factor. For signs and symptoms, skin is flushed, hot and dry. Experiences dizziness, confusion, and headache. Respiration and pulse are rapid and weak. Unconsciousness and collapse may occur suddenly. Treatment for heat stroke. Moving the casualty to a shady area. Remove outer garments and protective clothing if the situation permits. Pour cool water or immerse him and fan him to permit the cooling effect of evaporation. Elevate his legs. If conscious, have him slowly drink at least one canteen full of water. Seek medical aid and evacuate the patient as soon as possible. Perform any necessary life-saving
Kasabay ng
measures.
pagtaas ng temperatura sa summer season, tumataas rin ang bilang ng mga taong nakararanas ng heat stroke. Isa itong karamdaman kung saan tumataas ang temperatura ng katawan ng mahigit 40.6 degrees Celsius. Ito ay nangangailangan ng agarang atensyon dahil ito ay nakamamatay o maaaring maging sanhi ng damage sa utak at iba pang internal organs. Ang mahabang pagkakababad sa matinding init at labis na aktibidad ay maaaring maging sanhi ng heat cramps at heat exhaustion na maaaring magresulta sa heat stroke. Mas malaki ang tsansa na makaranas ng heat stroke ang mga batang 2 taong gulang pababa, mga diabetic, may sakit sa puso at ang matatanda. Kaya ngayong summer season, mahalagang malaman natin kung papaano ito may iwasan at ano ang mga maaaring gawin sakaling ito ay mangyari sa atin o isa sa ating mahal sa buhay.
Ang heat stroke ay isang kondisyon na pwede makuha dahil sa prolonged na pag-stay mo sa isang lugar na sobrang taas ng temperature. Ang manifestation niya, pwede kang magkaroon ng sakit ng ulo, pwede magkaroon ng pagkahilo, pwede rin magkaroon ng manifestation na para ka nagkakaroon ng totoong stroke ng pagkahilo ng katawan. At pag tumagal ka sa ganung kondisyon, pwede itong magkaroon ng sanhi ng pagkamatay. Ang pinakaiba ng heat stroke at heat exhaustion, ang heat stroke, mas matagal ang recovery at mas malala ang manifestation. Usually, it will take weeks to months bago ka makarecover sa isang heat stroke.
Ang heat exhaustion ay isang kondisyon kung saan ang ating katawan ay nakararanas ng overheating, bunga ng pagkabilad sa matinding sikat ng araw, na kung hindi mabibigyan ng kaukulang lunas ay maaaring mauwi sa heat stroke. Kadalasan itong nangyayari sa mga taong nagtatrabaho sa outdoor, lalo na kapag summer season. Sakaling kayo ay maging bystander sa isang nakararanas ng heat exhaustion, ito ang mga kailangang gawin para kayo ay makatulong. Ito ang mga sintomas ng heat exhaustion: labis na pagpapawis, panghihina, restlessness o hindi mapakali, pagkahilo, pananakit ng ulo, pamumutla at pulikat. Unang hakbang na dapat gawin ay dalhin sa isang malilim at mahangin na lugar ang pasyente. Kung ito ay may malay, maaaring painumin ng tubig o oral rehydration solution. Kung walang malay ay ihiga ang pasyente. I-check ang ABC o airway, breathing at circulation. Kung maayos ang paghinga at sirkulasyon ng pasyente, ay i-elevate ang mga paa nito. Dapat ding siguraduhin na nahahanginan ng pasyente, kaya mas maiging kung ito ay papaypayan. Maaari ring maglagay ng cold compress sa kilikili, sa leeg at sa singit ng pasyente. Sakaling lumala naman ang kalagayan ng pasyente, ay agad na tumawag ng emergency medical services, kagaya ng 8911 UNTV. Dapat tandaan ang mga bagay na ito para makapagbigay ng tamang assistance sa taong nakararanas ng heat exhaustion. Scene safety. Safe ba na mag-conduct ng first aid sa lugar? Check ang level of consciousness. I-check ang ABC. Painumin ng tubig o oral rehydration solution. Tumawag ng emergency medical services kapag lumala ang kalagayan ng pasyente.
For the last part of our subject, we have transportation of casualty. It means moving the casualty from the point of injury going to the nearest medical facility where a casualty can receive a definitive care. Definition of terms of transporting casualty. Manual carries, means of transportation which provides comfort to the patient and are less likely to aggravate injuries. Litter carries, means of transporting casualty using a stretcher to carry a sick and wounded person. Litter, a device capable of being carried by 2, 4, or 6 persons for purpose of transporting sick, injured, or dead person. For proper handling of casualties, evaluate the type and extent of his injuries. Ensure that dressing over wounds are adequately reinforced. Ensure that fractured bones are properly immobilized and supported to prevent them from cutting muscles, blood vessels, and skin. And now, let's go to the one-man carry. Fireman's carry, the easiest way for one person to carry another. Support carry. In this carry, casualty must be able to walk or at least hop on one leg using the bearer as crutch. Arms carry, useful in carrying a casualty for a short distance. Saddleback carry, unconscious casualty for a short distance. Backstrap carry, the casualty weight rests high on the bearer's back. This makes it easier for the casualty bearer to carry the casualty for moderate distance. Pistol belt carry, the best one carry for a long distance. Pistol belt drag, these are generally used for short distance. It is also useful in combat. Neck drag, this is useful because the bearer can transport the casualty when he creeps behind a low wall or shrubbery or through a culvert. Cradle drop drag, very effective in moving casualty up or down steps. And for two-man carry, two-man support carry can be used in transporting in a conscious or unconscious casualty. Two-man arm carry, useful in carrying casualty for moderate distance. Two-man for and carry, useful in transporting a casualty for a long distance. Two-hand set carry, useful in carrying a casualty for short distance. This is the summary of what we have learned from our subject, Basic First Aid. Definition of terms. Importance of first aid. General procedure in case of injury. Basic life-saving steps. Climatic injuries. Transportation of casualty. That's all for today, and I hope you understand our discussion. Thank you for listening, and God bless you all.